St2 and endothelial injury as a link between GVHD and microangiopathy. Definition. There is an association between elevated levels of Ct2 protein and a marker of endothelial injury at the time of diagnosis of the graft versus host disease, and the resistance to glucocorticoid therapy among the recipe of hematopoietic stem cell transplantation. Ct2 is a dependent of neurotic temp, such as P, and therefore provide unique and complementary prognostic information.
What is endothelial dysfunction? It is the most common form of vascular abnormality. Endothelial cells are the inner lining of blood vessels. Each artery has 3 layers: the endothelial layer, medial layer, and adventitial layer. The endothelial layer is the innermost layer, the so-called brain of the arteries, and is considered the most important layer. What is endothelial function? Endothelial function is a misnomer. Endothelial cells have multiple functions. The vascular endothelium serves multiple functions. It regulates fluid and molecule traffic between blood and tissue. It is an anticoagulant surface. It contributes to vascular homeostasis and repair. It plays a central role in angiogenesis and tissue wound healing. It plays a vital role in vascular tone and blood flow regulation. Assessing this function is the most practical way of measuring endothelial function. Endothelial
GVHD means the graft reacts against the host. The graft is the donated marrow or stem cells. The host is the person receiving the transplantation. Video.
As you learn about or plan for a blood or marrow transplant, your transplant team will help you learn about GVHD. GVHD stands for graft versus host disease. Learning about GVHD and knowing the signs and symptoms to watch for can help you be more prepared for your transplant recovery. What is GVHD? GVHD is a common side effect of an allogeneic transplant. Allogeneic transplant uses healthy blood-forming cells, also called stem cells, donated by someone else. GVHD develops when your new donated cells do not recognize your body, and as a result, your body is attacked by
Is angiopathy affection small blood vessels in the body. It can be transported to angiopathy or a large vessel disease. Transplantation associated thrombotic microangiopathy is triggered by endothelial injury leading to complement activation of further endothelial injury, organ failure, and increasing mortality. Application in nursing. This kind of disease can be difficult to be treated. That's why nursing have a very important image in this situation. By setting all the aims of nursing out are promoting health and preventing aggravation in the disease on the patients. Pros and cons. Pros. The careful elevation of transplantation recipes and glucocorticoid resistance might identify additional therapeutic options. CTA2 have considerable prognostic value and is used as an assay of risk. Stratification in identifying patients who are at high risk of mortality and rehospitalization. Cons. It is difficult to say who will develop GVHD after a transplantation. We don't know exactly, but somewhere between 1 and 2 out of every 5 people having a donor transplant will develop some degree of GVHD.
In the ATG prophylaxis session, we will address 3 different ways of prophylacting GVHD. We will have a talk about pharmacologic agents in this field and to see what is the value of the different available agents in the prophylaxis setting. We will have also a talk about the role of polyclonal antibodies, namely the different ATGs, because these products have been shown over the last 20 years or so to be highly effective. Initially, we had retrospective registry-based data, but now we have all the necessary randomized phase 3 trials. In another word, ATG is proving to be a very powerful tool for GVHD prophylaxis, and in my opinion, and based on the available research evidence, should be incorporated in the conditioning regimen for transplant patients, whether you're talking about match-related donors or match-unrelated donor. We will have also
issues apply in Ecuador. No data respond about this case in Ecuador, but in other countries there are a large number of clinical trials in development or recently completed in the area of the new treatment for graft versus host disease, as well as in prevention.
Talking at the session on GVHD, and specifically I'll be talking about the use of ex vivo T-cell depletion. And we know that one of the main complications of an allogeneic transplant is graft versus host disease. And one of the strategies that we've developed now over the last 2 decades is the use of T-cell depletion, where we remove the T-cells from the graft to reduce graft versus host disease. Now, one of the issues there is whether you also lose the graft versus leukemia effect. And what we've shown now in patients with acute leukemia, both AML and ALL, as well as with patients with myelodysplastic syndrome, that when we use a ablative conditioning regimen in combination with ex vivo T-cell depletion using CD34 selection, that we get long-term survival in patients with significantly reduced acute and chronic graft versus host disease and low risk of relapse comparable to what we can see with unmodified grafts. And we've done data comparisons with the group at MD Anderson, where we've showed that our results in AML, ALL are identical in terms of survival and relapse rates, but significantly less graft versus host disease. And we have a paper which is in the preparation showing the same thing in myelodysplastic syndrome.
Conclusion. An elevation CTA2 level was significantly associated with TATMA and all the 3 cohorts. A variable that was not reported, on purpose, an important cause of the excess mortality. We address the relationship between TMA and GVHD using multivariate linear regression in data from recipe of the old allogeneic stem cell transplantation. There are treatments to prevent GVHD. Dr. Fine turned to the use of these treatments. They try to lower the risk of serious GVHD as far as possible, but still keep some beneficiation of GVHD.